Hi, I'm Dr. Attia. I'm a board-qualified chiropractic neurologist. That's in the field of functional neurology. You can look that up online, functional neurology. Just plug it in on a Google search and you'll come up with that, and you'll see what functional neurologists are doing. Some really miraculous work. In this, we treat patients that are, say, post-stroke, Alzheimer's conditions, those kind of neurologic conditions that, physicians will kind of scratch their head and say, what the heck is going on here, okay? Could be a variety of different things. Could be even peripheral neuropathies. Could be plantar fasciitis, arm pain, leg pain. It just depends. Any disorder that has to do with the neurology, that's what we deal with. And in functional neurology, here's what we do. It's really pretty cool, okay? Absolutely no different than if you have a wiring problem within your household. If you know that the light bulb is going on this path, or that section of the brain is working on this path, but it's not over here through testing, and we do that through physical testing. I don't use needle EMGs or anything of that nature. Then I find a pathway on the one that's working to connect the two, to rebuild the other section, to rebuild the light bulb where the one that isn't working properly. We do that through various exercises, frequency-specific microcurrent, some yoga work that we do. We also use the Grostic technique to open up the channel up in here. Most people don't realize that the brain actually extends, can't see it on here, but down to about here. It's known as the brain stem, the mesocephalon, the pons, and the medulla. This is where the cranial nerves come off. This is where their nuclei, this is where they start, okay? And adjustments to this atlas are extremely powerful in this area. I've seen kids with ADD and autism. There was just a study done on kids with autism that 86% of the children improved with the use of this technique, the Grostic technique. That alone, not changing diet or anything. I mean, that's quite remarkable. No drugs, nothing. And the cost was negligible compared to what else is, what is traditionally used out there. So for neurologic disorders, be it migraine headaches, be it strokes, post-stroke, Alzheimer's, autism, neurologic disorders, Pott's disease, that's another one, Pott's disease, postural orthostatic tachycardia syndrome. Often that is an autoimmune disorder, but it is neurologic. Those of you with Pott's disease know what I'm talking about, that it's very debilitating, and there's a lot of medications associated with it. On our testimonial page, we have a young lady that had Pott's disease. She no longer does. Okay, we've been able to help her. So thank you for your time. If you have any questions, please call.